New York's classic rock, Q1043.
And we are back. I want to introduce you to Barbara Rosen. She is a longtime critical care nurse. She's a nurse educator. She is a leader of the health professionals and allied employees of the AFL-CIO. In fact, in 78, she worked to organize a union at what was then Bergen Pines Hospital. It is now Bridge Medical Center. And the reason I've invited Barbara to come on today, we've talked before about the issues that have been plaguing our frontline workers, particularly the nurses, but Barbara has historical perspective that we have not talked about yet because she was also on the front lines of the AIDS epidemic. And so she has the perspective on dealing with two really nightmarish health issues. She was there for both, and she also has a perspective on the violence that is plaguing some of our frontline workers. So good morning to you, Barbara. Thanks for your lifetime good work. Not many people can say that.
That's my claim to fame, that I graduated nursing school with Florence Nightingale in 1975. So I am a very long-term nurse. It's interesting, when I started working at Bergen Pines then, and it was before I graduated nursing school, I was a nurse's aide there, we were still taking care of patients from the polio era. And as a matter of fact, we still had two patients that were in iron lungs for several years. So that's what disease looks like. It could be long-term and enduring. And we've been through a lot of different pandemic planning with N1H1, and of course the AIDS, right, with it.
And of course, in the beginning of AIDS, I mean, people didn't know how you got it, didn't know how infectious it was. Some people did not want to be in the same room as a victim who was fighting AIDS. What was that like as a nurse?
You know what, I would say, like, during the AIDS and epidemic, we felt a lot more protected then. You know, that was a bloodborne disease. We didn't run out of personal protective equipment. You know, we were able to contain and take care of the patients. And by no means was it in any volume like what we see today with COVID, right? So, I mean, it was very, very disheartening. I remember taking care of some young patients that succumbed, you know, to the disease. And you know, it's very emotional for a nurse to lose a patient, you know, which is one of our largest problems today, you know, with the mental health repercussions that have occurred after this. You know, by nature, I think not just nurses, but all healthcare workers are probably the most kindest people on the planet, you know, and the most compassionate people on the planet. So it's been very, very disheartening, you know.
You were the victim of workplace violence?
Personally, no. I have not. I've seen a lot of it and have been able to not get hurt during it. Their workplace violence has been ongoing for years. You know, the thought process with that, it's part of the job, but you know, we're saying it's not part of the job to get hurt. We have seen our members be involved with violent issues and end up hospitalized and out for a very long time, you know, on disability. And I would say to you now, during this COVID pandemic, it's greatly escalated. We're hearing more and more incidents coming up in our hospitals with it.
In what way? What has been happening? What have you been hearing from your members?
We've been hearing that the patients, and you know, I think it's compounding with a lot of things. People are very nervous about COVID. They go to the hospitals, and as you know, the hospitals are at a breaking point with the capacity. So if you go to an ER, you might be sitting there for a long time, like waiting for care. We're hearing things across the nation that people are waiting in ambulances, right? Because there's no room in the ERs to let them in. And it's very frustrating for a patient, right? And I think they act out more. And there is probably an increase of substance abuse as it relates to, the COVID pandemic, and that adds to the violence. We're seeing it mostly in our ERs.
I'm speaking with Barbara Rosen. She's a longtime critical care nurse and nurse educator. She is a leader of the Health Professionals and Allied Employees, AFT, AFL-CIO. And she was actually working way back in the day to organize a union at what was then Bergen Pines Hospital. And she has a historical perspective that we really have not heard from so much during the current pandemic. Are things beginning to calm down? We've been told that we are past the peak with Omicron, and are things easing in the hospitals now from your perspective?
In some of our hospitals, but our latest report says that we still have hospitals out there that it's not easing. They're seeing more ICU patients, which I guess is what you could be expected with the curve of the pandemic. Some of our hospitals have opened up additional ICUs. And the crux of it is they're working very short-staffed. I just read an article today that the American Nurses Association is calling for a crisis, a nursing crisis, and that's where we're leading to. So if we look back to 2020, when the onset of the first wave of COVID hit our hospitals, we had staff, hospital staff, nurses, doctors, respiratory therapists working with totally inadequate personal protective equipment, right? And at that time, there was no declaration that it was airborne, that it was more or less thought to be a droplet. And the end result, and at one point, we were so low on PPE that the CDC was saying, if nothing else is available, wear a bandana.
And I remember the pictures in the New York Post of the employees. I think it was Mount Sinai, who were wearing trash bags.
Right, trash bags because they ran out of gowns. And it was a horrendous situation. The net result of that was many, many healthcare workers got ill. In our union alone, we had 7 deaths related to hospital workplace exposure, COVID. Ironically, the death count of hospital workers is data that cannot be found anywhere. So we don't really have a handle on how many actually have succumbed to these working conditions. But we know of many, many that are out with long-term COVID and have been out on disability with all sorts of side effects. Somebody lost their hearing. We have a nurse that needed a kidney transplant. There's been cardiac issues, all sorts of things. So there's many that are out with long hauling COVID.
And of course, you mentioned the stress, besides being overworked, the stress. So in a perfect world, Barbara Rosen, what do nurses need right now? What can be done?
What they need is a safe working environment. And I have to really stress that when there's a safe working environment in the hospitals, it's a safe place for patients, right? So right now, they seem to have enough PPE. We've heard no complaints about that. But the biggest issue is the staffing and how they can take care of patients, because many of our nurses have left, right? So just think of the nursing statistics nationwide. The average age of a nurse right now is about 59 years old. Many have decided to retire early because they're not working in the environment. Others are out with disabilities. Others have said, even the younger ones, I'm not subjecting my family and myself to this kind of situation. During the first wave, we had nurses sleeping in their attics in their cars, trying not to expose their families to it. And then there's another group that have left to take very high paying traveling jobs. So it's added to the understaffing. And I have to tell you that before COVID, okay, staffing was an issue in our hospitals.
So how do we fix this? I know the president sent in military, but that was only 2 hospitals in our area. That was only Coney Island Hospital and the University Hospital in Newark. Only 2 hospitals in our area. Is that the answer, to send military medical personnel to all these hospitals? And would there even be enough in the military to cover the need?
It's a very short-term solution. I think when we're looking at the situation, we're looking at this isn't going to be solved at the end of the pandemic unless some real solutions come in to get people into the field. It has to be addressed through our higher education to get more nurses turned out at the bedside, more respiratory therapists, more hospital personnel. And then the other thing is to get them to stay, right? And that will only be solved with an adequate working environment, okay? They want to be able to go in and do the job and give the level of care that they were trained to do, and that's really not happening right now. And we're seeing in some of our hospitals offering these tremendous bonuses to have people work extra, and people still don't want to do it because of the work environment, the stress, the physical and mental stress that's involved with the job.
So what do you think can be done? I mean,
Well,
it sounds like a no-win situation.
I mean, short term, okay? Short term, we have to protect the healthcare system with the influx of these patients. And what we have seen has been astounding, okay? In December, it was actually on December 21st, we had a meeting with the Department of Health, who warned us ahead of time that this surge was coming, okay, and that staffing was going to be an issue. We had discussion with her, and some of the measures that they were taking to try to put a Band-Aid on the surge, which is, calling in the National Guard and thinking of different delivery of care models in the hospital. And we're trying to support and work with that as much as we can to get through the crisis. But only a few days later, on December 27th, okay, the emergency temporary standard that was put out by OSHA wasn't renewed. So the emergency temporary standard was something that was put in place to make the hospitals a safer workplace, and not just the hospitals, but everywhere.
What was that standard?
It was a standard through OSHA, and it talks about air quality and protections for respiratories, and it was removed. And, we're looking at this saying we're in the middle of probably the worst surge that we saw. The timing couldn't be worse. We have people that are working at tremendous levels, so stressed out, and now we're removing protections. And then on the same day, the CDC comes out and they lower their quarantine standards. And there's no testing option to make sure that the person is safe. I mean, this is a recipe for disaster. They're trying to get people to work, even though they still may be contagious. Okay, maybe they're still feeling too sick to work. And they're saying, if you're not symptomatic, put a mask on and come to work. Okay, so staff can't keep masks on all day. They need to take a break. They might be eating in a room with somebody and spreading. So, I mean, we were totally dumbfounded by these 2 moves where the timing possibly could not have been worse, okay, for the country.
Uh, Unfortunately, we are out of time. And of course, there's so much left that we could cover. Thank you, Barbara Rosen, longtime critical care nurse in New Jersey. If you missed any part of this, download the iHeartRadio app. It's free, and my interviews live on under the podcast Sunstein Sessions. And I'll see you guys tomorrow morning on the Jim Kerr Rock and Roll Morning Show, Q104.3.
New York's classic rock, Q1043.